Welcome back to New Day Northwest. Think back to life in 2020 when COVID was just getting started, and then fast forward to your life right now. Do you learn some things about yourself? Well, a new book titled Inequality Kills Us All takes a look at how COVID impacted society as a whole and what we can learn from that. Author Stephen Bezruchka joins me now. Thank you so much for being here with us.
My pleasure, Amity.
So did COVID have a big impact on your life in such that you decided to write this book?
I have been thinking about these ideas for 25 years. That is, back then I learned that when we consider the health of a country, meaning how long people live, we didn't live that long compared to other countries. Say in the 1990s, there were 25 countries where people lived longer lives.
Really?
And that disturbed me because I worked as an emergency physician for 30 years, and I thought medical care and the high standard of medical care in the United States would make us one of the healthiest countries in the world.
And we're not.
And we're not. Furthermore, things have gotten worse, and COVID especially made it much worse.
When we look at medical care, it only has a modest impact, you say, on producing health. Explain that.
So that's tough for Americans to consider because we conflate the terms. We access health, pay for health, get health, insure health, when that really refers to health care. So we assume that it's health care that produces health. Having worked as a doctor for all these years, if I had a homeless person come in that had been weak and dizzy for 6 months, I could spend a few $1,000s on tests to decide whether he needed to be hospitalized or not. Typically, I had to treat him.
What does that mean?
Well, he had to leave. He took a shopping cart into the ER. He wheeled it out of the ER.
Okay.
He didn't, often I had these encounters. If medical care treated the whole person, I'd at least give them a meal and a night stay, and help them find a job and housing. Medical care doesn't do that. It's not in the list of medicines or treatments we can prescribe.
We're talking about caring for the whole human, right?
Yes,
I mean,
yes.
we're talking about comprehensive care. Before COVID, we really saw some of these inadequacies when we were talking about cancer rates. So in rural communities, we saw not as great outcomes because of lack of access to alternative therapies, right? But you're saying COVID kind of blew the top off of all this nationwide, no matter where we are.
So let's unpack the title. Inequality Kills Us All. I'm summarizing the research that shows that income wealth inequality really provides conditions in which even the wealthy don't live long and healthy lives in this country. If you want, in other words, now there are about 50 countries where people live longer lives than we do in the United States. And we think that this doesn't apply to me, I hike up Tiger, I eat well, I have friends, but it impacts me as well as everybody else.
What do we need to do to change that? How do we need to start?
We need to decrease economic inequality. That is, we have the highest number of billionaires, although that's in doubt right now. China may be overtaking us. And there's this idea of a rising tide lifts all boats. Well, the rising tide lifts the yachts and swamps the rowboats. So we need to collapse the inequality in society. How do you do that? Well, we have to create awareness. One of the unique parts of the book is the last chapter, What Can You Do?, in which I outline the various things that individuals can do, working together, people in organizations, teaching. Tomorrow I teach at the University of Washington, and I teach a course called The Health of Populations, a course where the patient is the country. And so the students, their exercise is to create events where they tell others what I'm trying to tell you. So once people become aware, they can make the decision, do I want to live a shorter, sicker life or a longer, healthier one?
Right.
And that's a challenge.
That is a challenge. Well, I'm so grateful to you for writing this book, not just to, like you said, inform and educate, but give us an idea of what we can do to take action. Thank you so much. We appreciate your time.
Thank you for having me.
Absolutely. And just a reminder, Stephen is holding an author event tomorrow, Tuesday, January 10th at 7 p.m. at Elliott Bay Book Company. What an interesting chat it will be. All right.